The Chinese government has accused the U.S. of causing panic in its response to the deadly coronavirus outbreak.
It follows the U.S. decision to declare a public health emergency and deny entry to foreign nationals who had visited China in the past 2 weeks.
There are more than 17,000 confirmed cases of the virus in China. Some 361 people have died there.
Outside China, there are more than 150 confirmed cases of the virus, and 1 death, in the Philippines.
The virus causes severe acute respiratory infection and symptoms seem to start with a fever, followed by a dry cough.
On Monday, a study by a Chinese virologist said a pneumonia outbreak associated with the coronavirus had likely started in bats.
The outbreak took its toll on Chinese shares when markets reopened on Monday following the Lunar New Year holiday. The Shanghai Composite Index closed nearly 8% lower, its biggest daily drop for more than 4 years.
On 23 January, the U.S. ordered the departure of all non-emergency U.S. personnel and their family members from the city of Wuhan in Hubei province, where the virus originated.
Less than a week later, the U.S. allowed for the voluntary departure of non-emergency personnel and relatives of U.S. government employees from China.
On 30 January, the World Health Organization (WHO) declared a global health emergency over the new virus.
Following this, the U.S. ordered the departure of all U.S. personnel family members under the age of 21 in China.
Any U.S. citizen who has been in Hubei province will be subject to 14 days quarantine upon returning to the U.S.
On Monday, Hong Kong said it was suspending from midnight local time 1600 Greenwich Mean Time 10 out of 13 border crossings with mainland China.
Various countries have imposed varying travel restrictions and other preventative measures, including
the body that represents some of the world's largest cruise ship operators, the Cruise Lines International Association, announced on Monday that passengers and crew members who had recently traveled to China would not be allowed to board vessels.
In a news briefing on Monday, Chinese Foreign Ministry spokesperson Hua Chunying said the U.S. actions could only create and spread fear instead of offering assistance.
She said the U.S. was the first country to impose a travel ban on Chinese travelers and the first to suggest a partial withdrawal of its embassy staff.
It is precisely developed countries like the U.S. with strong epidemic prevention capabilities, that have taken the lead in imposing excessive restrictions contrary to WHO recommendations, Ms. Hua said, according to a Reuters report.
But Ms. Hua also said that China urgently needed medical masks, protective suits and safety goggles.
Global health officials have advised against the bans.
The WHO has warned that closing borders could even accelerate the spread of the virus, if travelers enter countries unofficially.
Travel restrictions can cause more harm than good by hindering info sharing, medical supply chains and harming economies, the head of the WHO, Dr. Tedros Adhanom Ghebreyesus, said last week.
The WHO instead recommends introducing screening at border crossings.
On Monday, Dr. Tedros again praised China for its commitment to fighting the coronavirus, stressing that the only way to defeat it was for all countries to work together in a spirit of cooperation.
More than 75,000 people may have been infected in the city of Wuhan, experts say.
But estimates by the University of Hong Kong suggest the total number of cases could be far higher than the official figures.
A report on the early stages of the outbreak by the Lancet Medical Journal said most patients who died from the virus had pre-existing conditions.
The report found that, of the first 99 patients treated at the Jinyantan Hospital in Wuhan, 40 had a weak heart or damaged blood vessels. A further 12 had diabetes.
Most people infected are likely to fully recover, just as they would from a normal flu.
An expert at China's National Health Commission (NHC) said that 1 week was sufficient for a recovery from mild coronavirus symptoms.
How has the coronavirus outbreak affected you? Has your family been affected? What about your business or your travel plans? You can share your experiences by emailing haveyourSay@bbc.co.uk.
Please include a contact number if you are willing to speak to a BBC journalist. You can also contact us in the following ways.
Or use the form below.